Ladies and gentlemen, in this particular episode, we're going to discuss about the prevention of hypoglycemia. We already discussed about the fact that less than 70 milligrams per deciliter is low blood glucose and that it is very important to prevent this. So, if you are to be diabetic and if you are to be using medication, do remember that the older medications such as the older generation sulfonylureas and older insulins have a higher chance of causing low blood glucose compared with newer insulins, newer generation sulfonylureas, DP4 inhibitors, SGLT2 inhibitors, metformins, alpha glucosidase inhibitors, and not to forget GLP-1 receptor agonists as well, and pioglitazone. So, do discuss with your doctor as to whether you can be shifted to these medications instead of the older medications if appropriate. Also, do remember that you need to be extra cautious if you are to be elderly, if you are to have any kidney problems or liver problems or any associated diseases such as hypoadrenalism or untreated hypothyroidism, and you need to discuss with your doctor about this. If you are to be having any loose stools or vomitings on a particular day, it is very important to check your blood glucose readings more frequently, and you may need to take medical attention as well and may have to skip your insulin or tablets depending on the medical advice only. Not to forget the fact that if at all you were to be having hypoglycemic episodes during middle of the night, it is important to take a healthy snack at bedtime and may also need monitoring of your blood glucose readings in the middle of the night, either using a glucometer or CGMS. Speaking about CGMS and glucometer, these are very important tools to monitor for hypoglycemia and prevent the same. Timely food intake is the mantra when it comes to prevention of hypoglycemia, and of course the right quantity as well. If at all you were to be planning to do any exercise which is not usual for you, you need to take an extra snack before you do that exercise in order to prevent hypoglycemia. If you are somebody who takes alcohol, especially spirits, make sure that you eat before you drink the spirit, or else you might end up having hypoglycemic episode. If you are a driver, make sure that you take food on time, make sure that you monitor your blood glucose readings and keep in the target range before you start your driving, and also if you are to be doing a long haul drive. We will discuss this in a different episode as well. If you are to be fasting because of religious reasons or for intermittent fasting, medical reasons, then you need to ensure that you discuss this with your doctor first and change your medications appropriately if the doctor advises, so that you are safe during this fasting period. So, ladies and gentlemen, hypoglycemia can be very dangerous, and it is very much possible to prevent hypoglycemia by taking food on time and by making sure that you use the right insulins and tablets, and of course the gadgets which are available for you to monitor for prevention of hypoglycemia. Do take care.